Those of you who've heard me before know that I label myself formerly the hopeless romantic, but now the very hopeful romantic. And one of the reasons is because of people like you and Dale Bredesen, who have now started to reopen the dialogue on estrogen, my personal favorite hormone. I love being a woman, and I embrace everything female and pink and frilly, and I love fairy tales and fantasy and happy endings. So we want to be happy, and here we are. What's near us? What's up the road? The happiest place on earth, right? Also known as Disneyland. So I thought, okay, this is the very tail end of this conference. You've been all so good. You've sat through so many lectures. So let's have a little fantasy and a little fun, right? And have some smiles. So I thought, estrogen, the most maligned of all hormones, right? What hormone has been betrodden and berated more than estrogen? The female hormone of life and love. So I stand here to defend estrogen and to educate everyone on the critical role of estrogen in this case, mental health. And mental health is about a balance. We always talk about hormone balance, right? That phrase. And I feel it's very related to the Chinese medicine, which has also been brought up. Like the yin and the yang, there's always a push-pull, a strain, counter-strain, right? In everything in the human body, there's always the plus, the minus, right? The electron, the proton. And think of estrogen as the great mediator. It kind of dampens down all the inflammation. It controls basically everything. And without estrogen on board, it's really hard for women to have optimal mental health. So I thought, because this is a fantasy and a fairy tale, and I hope it will have a happy ending, I thought, what's my role? And what's your role in this fantasy fairy tale that we're going to have for the next hour? So I decided to play two parts. And so I decided, who here doesn't identify with Cinderella if you're a girl, right? So I decided I'd be Cinderella. But because I'm the Earth Mother and I have 4 children and 5 grandchildren, I would also be the fairy godmother. So all of you in the audience are the little critters in the story of Cinderella. Remember the mice who came to save the day and the little birds? Because to make Cinderella reach her full potential, it took a village. So that's why we're all here, because we're here to help women regain and maintain their mental health by having the medical establishment understand what estrogen's role really is. This, you can see my disclosures. So why does it matter for women to be recognized as having issues? Because they do. You heard from Dr. Bredesen that women make up a higher percentage of people with dementia and Alzheimer's than men. And women have much higher rates of depression and anxiety than men do. And this starts to manifest with puberty. It is definitely a hormonally based issue. So women have at least 2 to 2.5 times the incidence of depression and anxiety compared with men. And it really takes its toll on women. I'm sure you've heard that something like 25% of women between the ages of 40 and 60 are now on antidepressants. Isn't that amazing? And women are on sleep medications like crazy. Who here sees patients that come in, the women, and they're on multiple drugs for sleep and mood and anxiety? It's really shocking. And we really need to look at why is this happening and how can we help? Because women do make up the bulk of people who suffer from anxiety and depression and dementia. To truly appreciate estrogen, we have to go back. We have to take a journey back millions and millions of years ago to the beginning. Because gynecologists, I'm a board-certified OBGYN, that's my beginning, and then I became board-certified in integrative medicine when I realized that my toolbox was really tiny and not very good to really help women the way I wanted to help them. But I was not trained in understanding what estrogen really is. Estrogen is the hormone of life and survival. I was taught that estrogen is about having menstrual cycles and reproduction. And of course it is about that, but it's about so much more. And when you think about it, doesn't that make sense? Estrogen has been found in the receptors for estrogen in very, very primitive creatures like clams, and they do not reproduce the way humans do. Estrogen is the first of all the steroid hormones. It predates testosterone and cortisone and, and aldosterone and DHEA. The other steroid hormone receptors came later. Estrogen existed in primitive creatures, not for the purpose of reproduction, but for the purpose of survival. It regulated their feeding, their temperature, all the metabolic processes were under the auspices of estrogen. And then as time went by and there was evolution, estrogen became part of mammalian type reproduction. And doesn't that make sense? Would you expect a creature like a human to reproduce if there wasn't metabolic health, right? So the body oversees all the metabolic functions of the female and makes sure that the female is healthy and has fat stores and everything is in order metabolically in order for her to successfully reproduce. We now know that, for example, the menstrual cycle in a female is a vital sign of her health. Fertility itself is a vital sign of health. We know that women who, for example, have anorexia, which was mentioned, they're not very fertile, right? Is that an accident? Does nature want women who are emaciated and malnourished to reproduce? Absolutely not. So one of the things that we do that is very wrong is we take unhealthy women and then we put them in IVF centers and trick their bodies into ovulating when they're really not ready. We need to help these women to get healthy. We now know, for example, that the children are epigenetically imprinted and altered by an unhealthy mom. That like women who are obese and diabetic, they produce children who inherently are dysfunctional just because of epigenetic malprogramming. We now know that estrogen receptors are on just about every cell in the entire female body because estrogen is about life itself in the female. If you look here, there are estrogen receptors in the brain, as you already know, right? Because Dr. Bredesen mentioned estrogen briefly, that estrogen is important, and mentioned the bone. Everyone knows that estrogen relates to bone because that became sort of talked about when drugs came out for osteoporosis, and they talked about it happened after women lost their estrogen. So there are estrogen receptors in muscle and joints. There's a reason why after menopause women have more arthritis, because the collagen itself has estrogen receptors. The joints have estrogen receptors. And after menopause, these tissues start to degrade. The GI tract, which we're going to talk about, every woman knows that there are estrogen receptors in the skin because after menopause, the skin begins to rapidly wrinkle and age. And of course, the reproductive organs, the mitochondria, right? My pal, Peter Bongiorno, he talked about mitochondria. I'm here to fill in the gaps of everyone's talk because what wasn't mentioned is that estrogen regulates many functions. In mitochondria, there are receptors, and estrogen, as we'll see in a minute, regulates some of the key enzymes. For example, superoxide dismutase, which is critical for mitochondrial health and function, is regulated by estrogen. If you do not have that enzyme, then in the normal process of creating energy in the mitochondria through the electron transport chain, you create some inflammation and you make this product called superoxide, which is highly, highly toxic and will kill the cell in the mitochondria, and it cannot get out. It's stuck in there. It cannot pass out. And it's this enzyme, which is controlled by estrogen, superoxide dismutase, which converts the superoxide into hydrogen peroxide, which can actually then diffuse out of the cell and through other mechanisms can ultimately be harmlessly turned into water. But you need estrogen for mitochondrial health, and that's very infrequently discussed. And the liver, after menopause, fatty liver becomes very common. We're going to talk about why the liver and the gut relate to the brain, which you already have previews on, because you now know from Dr. Bredesen's talk that metabolism links to mental health and cognitive well-being. Of course, we know the breast and the lungs, and one of the things that we're going to talk about with the brain is that the brain makes estrogen. Estrogen is made both as a hormone that's an endocrine hormone, where it's made in the ovaries and then travels to other organs for its effect. But it's also made in many organs as a paracrine function. It's made in the organ where it's used in the organ. And of course, that's how men and children predominantly get their estrogen. And have you ever wondered why all the talk about lead is so bad for children's brains? Well, lead happens to be, among other things, it's also neurotoxic directly, but it's an estrogen endocrine disruptor. Endocrine disruptors in our fairy tale, that is the evil stepmother. Those endocrine disruptors that get in there and wreck our beautiful estrogen function. So keep that in mind as I talk to you about estrogen, that when you add endocrine disruptors like you've heard, bisphenol A and bisphenol S, if you buy plastic and it says BPA free, what do you think is in it? BPS, which is at least as toxic, right? And phthalates, all those pretty smells, unless they're from flowers or plants, they're phthalates. Do not put them on you. And there's, we live in a world of endocrine disruptors, and heavy metals like mercury and lead are estrogen endocrine disruptors. There are 3 types of receptors in the body for estrogen: alpha, beta, and membrane receptors. And this slide is actually a little wrong because we keep learning more and more about how these receptors work. So alpha receptor is the one that's predominantly about metabolism and reproduction. And then the beta is predominantly about sort of mood and cognition and the softer things, you might say, like the bone marrow, the vasculature, the lung, the bladder. It works in the parts of the brain like the cerebrum, whereas the alpha is predominantly in the hypothalamus that controls a lot of the reproductive hormones like luteinizing hormone, FSH, follicle stimulating hormone. And membrane assisted, these receptors work on the cell membrane. The difference is when you have a nuclear receptor, they transcribe a protein, often an enzyme, which takes time to produce, hours even, sometimes even longer, whereas the membrane receptors create rapid effect through these things called kinases, so they can do very rapid changes. But it turns out that alpha and beta also have membrane effects, and alpha and beta can intervene on each other. And if you have a lot of beta, it can actually downregulate alpha, which is one of the reasons I want to mention, we'll get to it at the end, if you're going to give hormones to women, don't try to micromanage their estrogen receptors. We don't know what we're doing. So if you give a hormone that is only a beta receptor agonist, which is that? Estriol. Estriol, the predominant estrogen of pregnancy, has beta receptor activity only. So if you give like Biest, you're predominantly giving estriol, so you're basically giving an agonist for only one of the receptors. And that's a problem. As we'll see in a few minutes, it's the alpha receptor that works on many of the immune cells. So you've got to be careful. We are not smart enough to micromanage estrogen receptors. So how does the brain get estrogen? The organs that make estrogen themselves are the organs that desperately love estrogen. The breast in a woman makes estrogen. Why would that be? Because if a woman is breastfeeding and she gets an infection, then what would happen to the baby if she got really swollen and red and stopped breastfeeding? The baby would die. So estrogen is an anti-inflammatory product. It helps reduce inflammation, so it helps to dampen down the inflammatory effect in the breast. That's why the breast makes it. And we'll see it's made in the gut, and it's made in the brain. And it can be, the way that the brain gets estrogen is from the peripheral blood, like in women, make it. And of course, there's some that's made in fat tissue, and that can circulate, and that goes to the brain. And it's also made from precursors, and it's also made like, androgens, like testosterone. All estrogen in the body comes from androgens. They're converted by an enzyme called aromatase into estradiol. So testosterone, DHA are all precursors of estrogen. So the blood can pass through into the brain, and the brain can use those androgens to make estrogen. That's how men get it, okay? In fact, men make a lot more estrogen in their brains than women do, which is why they don't suffer as much from dementia. Because after menopause, this is a double whammy. Women get less estrogen produced in their ovaries. They also simultaneously get less produced in their brains. Why nature did that to us, I do not know. But almost every woman has some cognitive changes as well as mood changes, which we'll talk about around the menopausal transition. So estrogen can also be made in the brain directly from cholesterol. So that's why, of course, we want to have cholesterol, right? We don't hate cholesterol. Cholesterol is so important to the body that it has a perfect recycling mechanism. What we don't want is inflamed or oxidated, right? We don't want oxidative LDL. That's what causes plaque and problems. It's all about inflammation and oxidative stress. We now know that the drug that was used in the Women's Health Initiative, which I also call that study the evil stepmother too in our fairy tale. I think the Women's Health Initiative did so much harm to women's health. It set us back so many years in thinking properly about estrogen. We now know that when you take oral estrogen, it's converted through the digestive tract and the liver into estrone. It turns out that estrone is not good for the brain. The brain does not like estrone. It only likes estradiol. And in fact, the brain doesn't convert estradiol to estrone like other organs do. So when you give an oral estrogen, you are not helping the brain because it's not getting in as estradiol. That's a really important message. That's why Premarin is not good for the brain. So estrogen, estradiol, is amazing for the brain. It's incredibly neuroprotective. It helps to create new nerves. It creates neurogenesis. It helps to create new synapses. It creates neuroplasticity, so you have more connectivity in the brain. It also works with the dendrites. The dendrites create the more interconnections. It's extremely neuroprotective in its own right. So I want everyone to repeat after me. This is a huge take-home message. Estrogen is neuroprotective. Great. No matter what else you forget, just remember that. But it works indirectly too. You've heard about the blood-brain barrier. Estrogen works on arteries. It protects the endothelium. Estrogen maintains the blood-brain barrier. That's why endocrine disruptors are so terrible. They break down the blood-brain barrier, and estrogen can't fight against them. But then when you have a woman in menopause who has lowered production of estrogen on site in her brain, low to zero, production from the periphery, the blood-brain barrier breaks down. That is a terrible thing for mood and cognition. So estrogen also helps glucose to get into the brain. You know, there's been so much talk about ketogenic diets. Why is that? What's the preferred food for the brain? It's glucose. It is not fat. The brain, though, is so wonderful that it can use many different energy sources, but the preferred is glucose. And this is, by the way, like a conserved gene effect. This goes down through the hierarchy of organisms throughout the whole animal kingdom. But you can't get the glucose in without estrogen being there, because the glucose transport system depends on estrogen. So that's why the backdoor thing of get the ketones in, because the brain can definitely use ketones as well and do well on it. But its primary and its preferred source of energy is glucose. But without estrogen, you can't properly transport glucose across into the brain, across the blood-brain barrier, and then into the cells. And that's why diabetes is one of the, that's among other things, because it also creates other inflammatory effects, is a cause of dementia, because you can't get the glucose into the brain to create the energy. The other thing that estrogen does is it regulates nitric oxide synthase. Have you all heard of nitric oxide? I talk a lot about great, because nitric oxide is a signaling gas. It's the only gas in the body that works as an amazing signaling process agent, and it can act as an antioxidant as well, and it works all over the body, and it works in arteries. And nitric oxide synthase, endothelial nitric oxide synthase in the arteries, is controlled by estrogen. And inflammation creates problems with the production of nitric oxide synthase. It blocks it. But estrogen can override that. But in the absence of estrogen, and as you increase inflammation, you get arterial degradation and you get hypertension. And of course, the arteries in the blood-brain barrier will not function properly. So there's endothelial and neuronal nitric oxide synthase to create this product, nitric oxide, which can do amazing, wonderful things. But like a lot of things in the body, you have that yin-yang. So you also have what's called inducible nitric oxide synthase, and that acts as part of the inflammatory process in the body. But when it's uncontrolled, you get uncontrolled inflammation, and estrogen helps to control that entire system. Estrogen controls the immune system of the body. You've heard of the glia, right? You've heard people talking about the glia, the microglia. There's astroglia. There's mast cells. Estrogen has receptors on all of those cells. Estrogen controls the immune system of the brain. So the way I look at it, when you lose estrogen, you have like weapons of mass destruction with no control, because as you can see, and we'll go over it more, these immune cells are designed to protect against invaders, but they're also designed to heal after the invader is controlled. But it's estrogen that gets it back into that proper control. Without estrogen, it's like weapons of mass destruction rampantly destroying the brain. There are estrogen receptors throughout the body, and what's happening is that estrogen controls many of the genes and the product of genes. So this is something that, you know, you have this slide, but many people don't realize. You've heard matrix metalloproteinase, haven't you, in other talks? Estrogen controls the gene expression and the production of matrix metalloproteinases. It's all about tissue remodeling, but in a good sense. But when you have matrix metalloproteinases out of control, they're like destructive agents. But they're what really estrogen actually helps to control cardiac remodeling. For example, after a heart attack, in a good way if you have estrogen on board. But without estrogen, you can have uncontrolled matrix metalloproteinases, which can destroy cardiac health and muscle tissue. So like PON1, peroxidase 1, that prevents the oxidation of LDL. Estrogen maintains LDL receptors in the liver. so that cholesterol is properly metabolized. Without estrogen, the liver doesn't get the right signals, and it starts putting out glucose. Gluconeogenesis becomes uncontrolled, and that leads down the road towards diabetes. That's why after menopause, women have much higher rates of diabetes and prediabetes, because the LDL receptors in the liver are not working properly. None of these issues are working properly after menopause. This is like the COX-1 and 2. They're inflammatory. Estrogen helps to control them. It's the yin-yang, and estrogen sort of monitors all. The prostacyclines, that make prostaglandins that are both inflammatory and anti-inflammatory, that help control all the functions in the body. So these are really key things that estrogen does everywhere. Estrogen is involved with all of these factors. You've heard all of these things talked about, right? You've heard about vascular endothelial growth factor and the brain-derived neurotrophic factor. I already told you about superoxide dismutase, and all the cytokines and cytokine receptors are all under the control of estrogen. And we're going to talk about brain-derived neurotrophic factor, which is so huge for women's health in their brain and with their mood and their cognition. So estrogen works to suppress inflammation in the brain, and it does it by dampening the impact of lipopolysaccharides, which come from a dysbiotic or inflamed gut. It helps to reduce the production of nitric oxide, which is inflammatory in that case, when you have upregulated nitric oxide, like inducible nitric oxide. And it reduces the inflammation in all other areas of the brain through the alpha and the beta receptors. So you can look at these and see that estrogen is all about survival of the brain. Now we're going to look at another piece of the puzzle, the amazing immune system. So here are some of the cells of the CNS. A lot of these look familiar. They look like the peripheral cells. And in fact, the glia, the microglia and the astroglia are all relatives of the macrophage. And the dendritic cells are part of the immune system that interfaces between the adaptive and the innate immune system, are the dendritic cells. But we'll see the mast cells do that as well. And the mast cells are not up here. Oh yeah, here it is. Here's the mast cell, a very key. You've heard a lot about mast cells, right? There's a lot of mast cells in the brain. It's a very key issue, controlled by estrogen. Estrogen receptor alpha is on all of the mast cells. So here you can see that estrogen controls all of these different things. Look, it's the immune system from top to bottom, the innate immune system, the adaptive immune system, the T cells. You've heard all about Th1 and 2 and the Treg cells. All of these have estrogen receptors on them. They do not work properly with estrogen being absent. And estrogen is very important with the dendritic cells, which are the crossroads between the innate immune system, which are the non-discriminatory cells, like the neutrophils, the mast cells, and the adaptive, which make, like the antibodies, the B and the T cells. Estrogen controls the dendritic cells, which interfaces between them. So estrogen has functions with every single one of these cells, which we just talked about. And if we go back, I just want to touch on the mast cells. I know you've heard a lot about mast cells, so I don't want to go into it too much. But mast cells are huge as far as protectors. They're the first responders. Okay, so mast cells line, and they're by blood vessels. They're at the interface between the outside world and our inner bodies. So you see a lot of mast cells around the skin and in the nasal passages, in the lungs, and they're in the blood-brain barrier and around the dura. They're the first responders, they're protectors. So they're the only cells in the whole body that actually contain tumor necrosis factor alpha, ready-made. and they can make all kinds of inflammatory products. And so they're like landmines or grenades. They don't care who it is. They just say, you're evil, you're not getting in, and they just start exploding and releasing these inflammatory products. And they release chemokines. That's the attractors that bring in the troops. Come on, macrophages and neutrophils, come, and the monocytes, and they call in the troops. So they're there to protect us, to keep us healthy. But what happens when they're dysregulated? Without estrogen to control them, once again, they're like weapons of mass destruction without the proper control. Mast cells have receptors to tons of things, but I want to emphasize 17-beta estradiol is a key one. But I also want to mention, look, it also has receptors to corticosteroids and cortisol-releasing hormone, right? So that's very important, and this is another important, really big take-home message, that mast cells work with the adrenal axis, both pro and con. It's bidirectional. So if you have stress and you start creating more cortisol, that will upregulate the mast cells. And in turn, the mast cells then feed back to upregulate. It's a bidirectional thing. So the stimulation of the brain mast cells leads to activation of the HPA axis, and in turn, there are receptors on the mast cells for those products, those hormones, and it then stimulates the mast cells. So now you can see why meditation is wonderful, right? It will downregulate this really horrible inflammatory process. And melatonin is a very key regulator of mast cell secretions. Now, melatonin, as we'll see, is very important with the circadian rhythm, which, preview of coming attractions, the circadian rhythm is controlled by estrogen. So this you can look at. It just shows the amazing different functions of the immune system that mast cells have. And with both the direct defense, like they're killers, you're coming in, we're going to kill you, and with the more sophisticated innate and adaptive immune system. And as you can see, as I mentioned, they line the blood-brain barrier. They're in that area. And when they become very dysregulated and start secreting, they disrupt the blood-brain barrier. That's one of the mechanisms why that happens, is that they disrupt the blood-brain barrier, and then, bad things happen after that. So this I would love for you to look at your leisure. It really shows so many of the different functions that the mast cells have regarding all the different types of immune responses and how it relates to the blood-brain barrier, to different forms of immune health. And that there are receptors on there. They have toll-like receptors on mast cells. So mast cells can actually perceive lipopolysaccharides, the endotoxins that are produced in the gut that can circulate out with leaky gut and then get through the blood-brain barrier, which is so devastating. The mast cells can sense that, and then they respond by exploding, creating more inflammation. And this is just to show you how pain relates to inflammation, because mast cells activate the pain cells, the pain receptors, because through the prostaglandin issues, and cause muscle contraction. So you can see how mast cells, you're going to hear more and more about mast cells. They're key to so many things in our bodies. So basically, I want you to realize that the inflammation that we talked about in the brain relates, and this was mentioned by Dr. Bredesen as well, to peripheral inflammation. So when you have peripheral inflammation and then it breaks down the blood-brain barrier, it creates inflammation in the brain, neuroinflammation. And as you can see here, once you get the microglia activated, remember they're like the macrophages of the brain, they produce this. What is that? That's chemokines. They call in the troops, so that brings in more inflammatory cells directly into the brain to create more inflammation. And without estrogen, these cells are not properly controlled. So basically, the take-home message is that the microglia are like the sentinels of the brain. They're the key immune system of the brain once you get past the mast cells. And I'll show you a slide here where I want to Yeah, I want to focus on this slide. This shows you estrogen and progesterone. I've been focusing on estrogen, but progesterone is also very neuroprotective. You've probably heard that. They've actually done some research in giving traumatic brain injury patients IV progesterone. So if you look here, this macrophages, this was also mentioned by one of the other speakers, has two forms, sort of the quiet form, where it's actually not just sitting there, they're not dormant, they're actually surveilling the whole environment. And then there's the active form. So if you have an intruder, an inflammatory issue, like some kind of toxin or an inflammation from an infection, the microglia rapidly, it's like bang, they just start going after them. They can gobble them up. They put out all kinds of toxic chemicals to kill the invader, and they create havoc in the brain, but then in a natural, normal situation, they then repair it. They actually gobble up and they do repair. So they're about inflammation and they're about repair. But without estrogen, you don't get the proper control. So you get here, without estrogen, you get lots and lots of, here, the top one, it's pro-inflammatory. And estrogen and progesterone help to inhibit this effect. So it slows down this inflammatory response because inflammation must end. Our biggest problem is inflammation that just goes on, chronic inflammation. The body was designed for acute inflammation and then healing it, resolving it. We call it resolution phase, right? Estrogen helps to create that resolution phase. And without estrogen, you go down this path, which is loss of the blood-brain barrier, damage, inflammation, all the inflammatory cytokines, and the troops get called in. But with estrogen, it helps moderate it, and it reduces all that inflammatory process. When you have inflammation or trauma in the brain, estrogen is so important to dampen down that inflammatory response that the astrocytes actually start making estrogen very aggressively. The neurons can actually make estrogen as well. So you get this outpouring of estrogen in a brain that's inflamed, if it can work properly. And that's the goal, is to try to dampen it down and to maintain the blood-brain barrier. But when you have chronic, unremitting inflammation, estrogen can't win the battle. And that's what happens in breast cancer, guys. Because you have chronic inflammation in the breast, the estrogen is being produced like crazy in the breast, trying to dampen down that inflammation, but it can't win. The inflammation just doesn't stop. It wasn't designed for constant inflammation. That's why you have increased breast density, right, in a menopausal woman that is at higher risk because she's making all that estrogen in her breast. And when you have inflammation, it causes DNA breakage. And then estrogen is about healing. It's about proliferation, creating new blood vessels. Estrogen controls platelets for healing purposes. But when you have uncontrolled inflammation, wherever it is, and estrogen can't handle it, it can promote uncontrolled proliferation. It's a normal, like Dr. Bredesen said, Alzheimer's is the brain trying to protect itself. That's what's happening with estrogen in the brain when it can't keep up and if there's not enough of it. And in breast tissue, it's trying to protect the breast, but in the end it can't, and then you end up having a normal system fall apart and you get breast cancer. So it's all, everything interrelates, right? You all see that now, how it doesn't matter whether you're talking about this, that, or the other, there's a correlation between them all. So let's quickly go through the circadian rhythm. There's a master clock that sits atop the optic nerve called the suprachiasmatic nucleus. The master clock has estrogen receptors. It also has testosterone receptors. It's unclear if the testosterone receptors are working straight as testosterone or they're being converted through aromatase into estrogen. But estrogen is the master controller of your master clock. And as we'll see, you cannot function properly if you don't have proper rhythm. The female body is all about rhythm, right? We have ultradian rhythms. That's small rhythms through the day, micro rhythms. We have circadian rhythm, the overall 24-hour rhythm. We have lunar rhythms. We have seasonal rhythms. And guys, you have rhythms too. We all got the beat. And if we don't keep the beat, we do not have good mental health. And that's part of the problem. So if you look here, you see that the brain, through here's our clock, controls everything: feeding, mood, the autonomic nervous system. You've heard, how many times have you heard about POTS today, or yesterday, the day before, right? POTS is an autonomic dysregulation, right? Estrogen helps maintain proper autonomic nervous system. There are receptors that work through the vagus nerve that are estrogen. So estrogen helps maintain the autonomic nervous system. And without estrogen, you get autonomic dysregulation, and you end up getting upregulation of the sympathetic system, and you don't have enough parasympathetic, because estrogen helps to maintain the proper beat with the vagus nerve. And just as a side note, we now know that when you give pharmaceuticals, matters. One of the questions I wanted to ask one of the speakers yesterday, who was talking about using sweating. Were you there? Sweating for detoxing. It's like, so what time of the day are you going to recommend they do it? The immune system is circadian. You probably know we are different creatures in the day and in the night. Our immune systems are different. Our metabolisms are different. So what is the best time? I would guess it would probably be when we would normally be sweating, probably more like midday. But I don't know. I would like to know. That's a great study we should do. There's not only the master clock in the brain, there are also peripheral clocks. In almost every organ, there are peripheral clocks. The brain has other peripheral clocks as well. So this is what we have to do when we lose our control of our master clock. It's not completely gone. It's just, do you remember the days of the wind-up clocks? And as they wound down, they weren't keeping time properly, so they could be like off by 20 minutes. You know, it's like, oh, this clock needs to be wound up. And so that's kind of like what happens with our brains when we lose our estrogen. The clock is just a little bit off. So every day when we wake up, it has to be what we call entrained, because it drifts a little. But in menopause, it drifts a lot. And if you have endocrine disruptors, it's drifting who knows where, because who knows what's going on. So it's important to try to do the backdoor way to moderate these peripheral clocks when we lose control of our central clock. But we can mess up our clocks even when we have plenty of estrogen. How do we do it? By having light all night, by eating at the wrong time. We can really disrupt our circadian clocks by doing bad lifestyle habits. Whether you like it or not, we are programmed in our genes. This is about genetic expression. This isn't like some kind of woo-woo thing. This is how our genes work. They are on a clock. And I have other slides that show this time of day is when this happens, and this time. Most people know, like, testosterone is produced primarily in the morning, like around 9 or so. Estrogen is predominantly produced in the first half of the day as well. Estrogen is circadian as well as lunar. We're not living to the beat, and when we lose our estrogen, it really gets even more off the beat. This is one study of just 8 days where they turned day into night. So like 12 midnight became 12 noon for just 8 days. And you can just see how this would affect the brain, because look what happened. Leptin, which helps regulate appetite, went down 17%. So those people got the munchies, right? They were hungry. They wanted to eat. They had no control. And look what happened to insulin. It went up 22%. That's why when people live poorly, they don't live with their circadian rhythm. They're eating at the wrong time. They're exercising at the wrong time. They're not sleeping properly. They get diabetes. They get metabolic dysregulation. And as we know, improper metabolism leads to brain dysregulation, mood, and so on. And look what happened to sleep. And sleep is so critical. And every woman, when she goes through menopause, has some sleep disruption. So we'll see. Now, I wanted to touch on some things that are near and dear to my heart that specifically relate to estrogen and circadian rhythm. Birth control pills. What the heck are they? Are they hormones? That's what people talk about, right? There's not a hormone to be found in a birth control pill. They are endocrine disruptors. Their goal is to disrupt the hormones of a female. If you go to PubMed and you put in ethinyl estradiol, the dominant pretend estrogen of birth control pills, it's listed as an endocrine disruptor. In the environmental medicine world, where these things are getting into our rivers and lakes, believe me, they're talking about them as endocrine disruptors. And the same thing with the progestin component, like levonorgestrel is creating havoc to the wildlife. And we're putting these in children. What are we doing? What are we doing? I know I can tell you that the sex hormone binding globulin does not come back to normal. I'm finding years later very elevated levels of sex hormone binding globulin in women who are on birth control pills. And I'm finding more cancers in them. We have to get some data. But what I can tell you is, look what happens with the circadian rhythm of young, healthy women on birth control pills. It changed everything. Their circadian rhythm of their cortisol, their melatonin, their blood pressure, heart rate, all these things changed. We better think about what we're doing. Nobody knew any of this when birth control pills first came on the market decades ago. We didn't even know there was a master clock until the 1990s. This is pretty new stuff, and yet nobody's changing. This cannot be too big to fail. If it's harming women. 90% of women now are on birth control pills at some point in their lives. And the Mirena IUD, the progestin containing with the levonorgestrel, we know that that has major impact. For example, it increases breast cancer risk 52% in a recent Finnish study. So you know it's not being good for your brain. Okay? And it prevents ovulation, so you don't have proper estrogen. You don't have your rhythm. You need the hormones, you need the rhythm to function properly. And we're altering who knows what in the long haul. And we're changing, by the way, the microbiome of the vagina, the uterus, which we didn't know that there were these microbiomes, but there are. And now we're altering them, and who knows what's happening. We're having increased rates of preterm deliveries and pregnancy complications and C-sections. Who says this isn't related to these contraceptive devices that we've been using on 90% plus of the population? Menstrual cycles are circadian as well, in that women, when they're at different points in their lunar cycle with their hormones, it affects their circadian rhythm. So that we know that some women in the luteal phase, after ovulation, they have quite a bit of change in their circadian rhythm, and they have phase advanced. So what happens is, and this happens in premenstrual disorders like PMS and PMDD, that they have phase advance. So basically, they're offbeat with the clock, their circadian clock. So at night when they go to bed, the time on the clock could say it's 4 o'clock in the morning, but their body's clock registers it as 7 o'clock in the morning, so they wake up. Do any of you have patients, women patients in particular, who have early morning awakening? They keep waking up really early, they don't know why, 3 o'clock in the morning, they're just waking up? That's a circadian rhythm dysfunction. It means they have a phase advance, and this happens in age. It happens because of hormonal deficiencies. Testosterone and estrogen are related because testosterone turns into estrogen for males as well in the brain. So basically, you really need to think about circadian disruption. The problem with melatonin, which I use, is that melatonin is also circadian, and it has different phases through the day and night, including during sleep. And we don't know yet what it means to the rhythm when we give a bolus dose just at bedtime. So I often give very tiny doses, like 0.5 milligram, 4 to 6 hours before bedtime, to try to help them reset the clock. So I mentioned with premenstrual dysphoric disorder, they also have decreased melatonin secretion. So think about it as a circadian rhythm disruption for the first time, and then work with them by doing things like light treatment and trying to exercise and timed eating, which I want to get to. Postpartum depression is very significant, and this is also now shown to be related to circadian changes. So I don't have time to go into all of the slides because this is like a 3-hour talk. So luckily you have all the slides so you can read them, but because I want to get to some of the different treatments that I do as well. But I want to mention that estrogen has a big improvement when they've done some studies on sleep and also mood. And it changes the rhythm of the melatonin when you have estrogen on board. Menopause, as we've already talked about, is not a good thing for women. I don't care how you want to romanticize it. There's nothing romantic about menopause and loss. And circadian rhythm dysfunction in shift workers and psychiatric illnesses in shift workers is very significant. Now, I want to touch on the gut because we're running out of time, and the gut is very key to this whole process. So let me just get to here. This shows that there are rhythms of the gut and the brain, and they interrelate. The microbiome, the bacteria in the gut, they have their own clocks. They are also on a circadian rhythm. And the gut microbiome changes when women go through menopause, and they get a dysbiotic gut because there are estrogen receptors throughout the entire gut. The entire gut. The enteric nervous system, which is the nervous system of the gut, which has parallel cells. There are enteric glial cells, just like the brain glial cells are in the gut. They make and receive estrogen. And the gut microbiome is very altered with birth control pills, we now know, changes the gut microbiome, and menopause changes the gut microbiome. And the rhythm of the microbiota in the gut changes. There are actually different bacteria through different times of the day in the gut microbiome. Now, I want to tell you one fascinoma, okay? We now discovered just in the last month that breast milk is circadian. Like, how amazing is that? That if you take and analyze breast milk from women at different times of the day, the content of the breast milk is different. So that's how rhythmic we are. From birth, the babies should be fed according to the mother's circadian rhythm, and that sets the baby's rhythm. But how many babies, you know, even moms who go back to work, I know I did this, I bottled the milk, and it got pooled, and who knows what time it was. I'm giving the babies the wrong time milk. And then what about formula? That has nothing in it. Our gut microbiota have their own clocks, but the whole clock system gets messed up when you don't have estrogen or in the presence of endocrine disruptors. So I want you to go home and take a look at this. I want to just quickly point this out. This shows how you have the gut bacteria, and then you eat all the wonderful foods, the polyphenols and the fibers, and they make metabolites. And the metabolites include things like short-chain fatty acids, but also they include vitamins, they include amino acids. It's amazing, the metabolites that the microbiota produce, and then they work in conjunction with the lining cells, and the lining cells then respond and make hormones like serotonin, which circulate through the gut and through the body, and the serotonin also can go to the vagus nerve. Think of the vagus nerve as a brain extension rather than as a separate nerve, and it relates to the metabolites. And the gut is not supposed to be an impenetrable barrier. Think of the gut lining cells, the enterocytes, as having little doors between them. And they open, like, remember the speakeasies? You have to do the special knock, and you have to have the special password, and then they open the door, and then you can get in. But what happens when you have a dysbiotic gut and you get the leaky gut, you have, like, all the doors open, and anybody can get in. And instead of that, and this shows the heavy, thick, protective mucus, which dissipates when you have the wrong microbiota, and you get that inflammatory. And it's the gut microbiota that help to create, in conjunction with the lining cells, this protective mucus coating, which here it shows it's gone. And then what happens is all the bad stuff, the lipopolysaccharides, the endotoxin, gets into the immune system here, which lines the gut. You already know that, right? That 70+% of the immune system lines the gut. And these are the Peyer's patches that make the TMB cells. These patches make estrogen. They're a paracrine estrogen producer because estrogen is so important to the gut to maintain gut integrity. Estrogen helps maintain the lining of the gut. And without it, you end up down here with all the bad stuff coming through. And the dendritic cells, they have toll-like receptors. They can recognize, as do the mast cells, this lipopolysaccharide. And then they explode with inflammatory products, and they create inflammatory products. And also the lipopolysaccharides themselves can enter into the brain itself. And we've already seen where that goes. Estrogen has receptors throughout the entire gut, the lining cells and the nervous system of the gut, and it responds both with and to the short-chain fatty acids like butyrate. And butyrate, here it shows the enteric nervous system. The lining cells, the lumen of the gut, does not have any nerves, but there's a tremendous network of nerves. These neurons and the microglia are all over, and they're receiving and recognizing the short-chain fatty acids and triggering information directly back to the brain. And the lumen has to go by the contents. And guess what? Estrogen controls this system, the enteric nervous system. Estrogen controls the secretion of digestive hormones and stomach acid. And you heard about what happens when you don't have enough stomach acid and you don't digest and absorb your amino acids, how that leads to depression and attention disorders and so on. Estrogen is key to the entire digestive process. After menopause, the incidence of GERD dramatically increases, and women have much higher rates of GERD after menopause, and men have higher rates before the age of menopause for women. So I want you to realize that the entire gut is controlled by estrogen. The receptors are everywhere. And it works here. So you have all of these functions. The short-chain fatty acids act as signaling agents. The short-chain fatty acids actually travel through the enterohepatic circulation to the liver, where they entrain, that's the word we use, entrain the liver clocks. So if you eat the right foods at the right time, even when you don't have enough estrogen, you can still help to get the right short-chain fatty acids to the liver to help keep their clocks right. And liver health is essential for metabolic health, is essential for mood health and cognitive health. So we won't talk more about short-chain fatty acids, but short-chain fatty acids have their own circadian rhythm. Everything has a rhythm. And estrogen helps to keep the beat. So we have to work with the fact that we lose our estrogen. So you can look at these. So this just talks about, I want to just touch on, this is pretty repetitious, so I just want to talk about that, that serotonin neurons exist in the brain and also in the gut. There are special cells in the gut lining cells that make serotonin. The microbiota also makes serotonin. And the brain cells make serotonin. And estrogen helps to maintain the health of those neurons. And estrogen is key to the enzyme systems that create serotonin. So without estrogen in the system, you don't make as much serotonin, and the serotonin neurons actually die. So as you age, you make less serotonin because you don't have the right hormones to trigger it. So I want to just put it all together. What can we do? I recommend eating primarily vegetables and fiber in the beginning when someone is having problems, whether it's metabolic problems or cognitive problems, because they're all completely linked. So we want to give them food for their microbiome. And you've already heard about the amazing polyphenol effect. And the different bacteria actually interact differently with different polyphenols. So you want to eat the rainbow of spectrum of vegetables, right? And fruits. You want to eat tremendous variety and lots of fiber to feed your microbiome. And I'm not going to go into if you have SIBO, that's a different lecture. But basically, you've got to get a healthy microbiome and help it by feeding them. We have starved them, killed them. Try to do everything you can to avoid antibiotics. You know that, right? That antibiotics increase the risk of everything bad now, we've discovered. Like 5 courses of antibiotics and you've doubled your risk of diabetes. And we know what that leads to. Meal timing. Try very hard to have your food condensed into fewer hours of the day. It turns out that if you eat by the beat, you can help and train the clocks of your liver and your microbiota. And in turn, that will reduce inflammation. And we have to reduce inflammation. Chronic inflammation is a huge problem. We now know that they call it para-inflammation. Para-inflammation is chronic inflammation, and it keeps the poor microglia in the brain in an upregulated state. And there isn't enough estrogen to calm them down. So they're always like putting out their poisons. They're basically destroying the brain with no recuperation time, no recuperation because the estrogen doesn't take it out, and that para-inflammation, that chronic inflammation just keeps going. But if you time your meals, and the best thing, the optimal thing, which very few people are going to do, including me, is eat the bulk of your calories for breakfast, and then like a midday or a later lunch, like 3 o'clock, and then stop eating, to try to have like a 16-hour fast every day. But very few people are going to do that. So as a second is and this has to be changed because new data has shown that it's not a 12-hour fast. You need a 13-hour fast every night to lower your risk of chronic inflammation, cancer, diabetes, and dementia and depression. So you have to make it a minimum of a 13-hour fast. And stop snacking. That's confusing your microbiome. If you keep eating, it doesn't know what time it is. So you want to eat never more than 3 meals, preferably 2, including a good breakfast, and no snacks. But if you feel desperate and you have to snack, try to eat fat, because that flies under the radar of mTOR, or the nutrient sensors. So try to go with fat as a snack. So we now know periodic fasting, where you don't eat for a few days, is like a reboot to the gut microbiome. It helps to repair the gut, and so you have less leaky gut. So we have to do everything to dampen down inflammation in the gut. And we now know that grounding, if you go out and camp for 2 days and you're lying on the ground, you can reset your circadian rhythm. It's like amazing what listening to your innate immune system's signals. Go lie down on the ground. Walk on the sand. Do things that actually will help you connect with Earth. Earth will give you electrons and help reduce inflammation and help restore your circadian rhythm. We now know that exercise actually corrects the microbiome. Isn't that amazing? That's what can exercise not do, it seems. So exercise can actually reset the microbiome. And of course, it has many other benefits. In terms of therapies, we now know that if you have a phase advance where you're like, it's 3 o'clock in the morning, but your body thinks it's 6 o'clock in the morning, and so you wake up. If you do like 800 lux at night, if you do bright light at night, then it actually will help delay that. So you might try doing bright light at night for people who keep having early morning awakenings. But for people who can't fall asleep, then you want to do early morning light. You're going to use light to try to retrain your brain with the timing. Oh, and also, they've done sleep deprivation. When I go on a very, very long trip, I try to stay up for the whole 24 hours before I go on the trip. And then when you go on the trip and you go right into their time zone, you'll find that you'll adjust very quickly. But you have to live with it. But I spent years doing so much OB at night that I got used to being able to stay up at night. These are a lot of the supplements I use, and you can certainly look them up, and there have been other talks on them. And hormones, I wish I could talk more about it. All I want to say is we're doing it wrong. We need to be rhythmic with our hormones. We just have to do studies to really understand, because there's no time in a woman's life when she has the same dose of estrogen every day, chronically 24 hours a day. So all I can tell you is we're doing it wrong. We have to figure out how to do it right. Putting it all together, you can see you have to have activity, light, food, and don't forget estrogen, the missing ingredient of our fairy tale. And thank you so much for joining me.